Good evening, I'm Jimenita Swain and welcome to the Bahamas Tonight, the weekend edition. Topping news tonight, Prime Minister the Most Honorable Dr. Hubert Minnis pitching the country's plea to the global community to ensure small island developing states recover from COVID-19. During his virtual address at the 75th United Nations General Assembly this afternoon, the Prime Minister unveiled the Bahamas' domestic fight against the global pandemic and how the government plans to transform the economy and tourism. Altavis Munnings leads us off tonight.
Prime Minister the Most Honorable Dr. Hubert Minnis declared to the world during his United Nations General Assembly address Saturday that the Bahamas, like other countries, was forced to temporarily close our borders and regulate the movement of people to put a lid on any spread of COVID-19. He noted that with tourism serving as the country's main economic earner, the country's priority is to always protect and save lives.
The temporary closure of our borders caused one of the largest declines in visitor numbers since the advent of modern tourism in the Bahamas. The slowdown in economic activity in some areas of the private sector caused an unprecedented increase in unemployment, prompting the activation of an unemployment benefits program and self-employed assistance program, as well as other social safety programs, including the National Food Distribution Program, the largest feeding program in our nation's history. Mr. President, the Bahamas is carefully formulating the gradual reopening of the economy to visitors. We hope to welcome some tourists this year. However, as we adjust to this new normal, we acknowledge that no country can survive this pandemic alone.
As the world patiently waits for a vaccine to once and for all mitigate the contagious spread of the COVID-19 virus, Prime Minister Minnis made this appeal.
While we remain cautiously optimistic for a viable COVID-19 vaccine in the not-too-distant future, we note the collaborative efforts of the COVAX facility to secure arrangements for developing countries. Developing countries should be able to access vaccines via a transparent procurement process at affordable market rates. We salute the doctors, nurses, other healthcare workers, and all on the front line who have sacrificed their own health in order to assist tens of millions of people around the world. They are the real heroes to whom the global community owes immense gratitude.
The Prime Minister acknowledged, though, that small island developing states like the Bahamas and the Caribbean community are among the most disaster-prone areas in the world that are under attack from various external shocks beyond their control. And pandemics, hurricanes, or even climate events do not discriminate when it comes to financing between low and middle-income countries and
the compelling question remains as to why middle-income countries are still being assessed by international financial institutions using outdated methodologies that give no consideration to a country's level of exposure, vulnerability, and ability to recover from exogenous shocks. It is to be noted that ECLAC's view of the COVID-19 impact estimates that developmental achievements in the Caribbean and Latin America have been reversed by at least a decade. World Bank projections point to at least 100 million people falling into extreme poverty. I therefore reiterate the call for the institutionalization of a vulnerability index in the decision-making processes of the international financial institutions and international donor community. I also echo the call of the region for the capitalization of a Caribbean Resilience Fund.
Prime Minister Minnis announced to the United Nations Saturday the country's bid to renew its membership on the Council of the International Maritime Organization, and the Bahamas will rely on invaluable support from UN member states during the re-election process. I'm Altavis Munnings, ZNS Network News.